Hi, it's Chris here from the National Education Union. Thank you very much for joining us this evening for our latest phone briefing. We've got thousands of members on this call. We're going to hear from our Joint General Secretaries, Dr. Mary Bowstead and Kevin Courtney, but we also want to hear from you. So if you've got any questions, all you need to do is press 0 on your keypad and you'll be put through to one of our operators. But to kick things off, I'm going to hand over to Kevin to make some opening remarks.
Hi, and thank you, Chris. Colleagues, there are thousands of you on this call, and that just tells us all something about how dramatic the last couple of weeks have been and how serious a situation our society is facing. And, you know, it's no sort of hyperbole to say this is the most dramatic and serious situation in our country's history in our adult lifetimes, I think, if anybody on the call. We have been working in the last weeks to try and keep our society as safe as possible, our schools as safe as possible, and our members as safe as possible in the circumstances of this terrible virus. And I just want to say thank you to the fantastic reps that we've got in schools up and down the country and the members who've really helped us to try and put the union advice and policy in place in schools. I'm going to say something briefly about our general position on how we should be running schools now in this special circumstance, something specific about special schools, and something specific about supply teachers and agency TAs. But if I start with our general, we're trying to get out a very simple summary of our position about what should be happening in schools right now. And we are saying that no one who is in one of the vulnerable categories, that is pregnant women, people with chronic COPD or asthma, chronic heart, lung, kidney diseases, there's a long list the government's given. Anybody in those categories should not be in school. And we're also saying that anyone who is a carer for or who lives with somebody in those categories should not be in school or college, because we need to keep them safe and we need to ensure, because if they get ill, it's bad for them and it's bad for the NHS, that we're saying that other staff who aren't in those categories, we do hope they will volunteer to be on a rota, because we do think that we have to find some way of looking after the children of the most key workers in the NHS, those who are going to save our lives. We think that we want to have the minimum number of children in schools in that situation, and we regret some confusing advice the government gave out last week, but we hope that we've helped to persuade them to change that advice as we go. We're saying that how the rotas happen in school, they should be negotiated with you, and we think that's really important, and that notion of negotiation also should apply to the sort of work that you're now asked to do from home. The deadlines on that work, if there are any deadlines, the usefulness of that work to the young people that you're supporting, and that's in general our summary position. Now, we've just done a survey about that. We're astonished by the rate of response on that, and Mary's going to report on that response and the results from that survey, asking how those things have been put in place from you. So thank you very much if you filled in that survey. Mary will come back to that. But just before that, so those things are all about the safety of people in school. We're now going to turn our attention this week to specific advice on how to keep yourself safe, the questions of hand washing, the questions of separation between teachers and children, etc. And we're working on that advice. We can discuss it a bit tonight. We're hoping to do joint advice with NIHT and ASCL. We're hoping to get Public Health England involved in producing that advice. And Mary and I are in a phone conference tomorrow with Gavin Williamson and those other unions, so we'll be raising those questions there. I said I'd want to say something specific about special schools. We think the government's advice on special schools isn't working because they've said that any child with an EHCP, that every child with an EHCP should be in school. We think that doesn't work in special schools, and we'll be pressing that strongly with Gavin Williamson tomorrow. We've talked with NAHT and ASCL about that today, and we think we're in similar positions. So we can talk more about that on the call. And finally, as a brief sort of headline thing, while most of our members will be being paid during this crisis, there are numbers of categories of members that we're very worried about. Supply teachers working for agencies rather than directly with schools, home tutors in some cases, TAs working from agencies, peripatetic music teachers. Many of those colleagues are facing catastrophic loss of their income as a result of the school closures. We think the school closures were the right thing to do to protect our society, but these colleagues should not be paying the price in this sort of way. The Chancellor's announcement last week about replacing 80% of the income of people, it doesn't necessarily apply to these colleagues because it applies to people who are classed as employers. We are pressing this case very strongly with Gavin Williamson tomorrow, specifically about education, and then we're pressing it via the TUC, with the Chancellor of the Exchequer, and we've got a meeting of the Public Sector Forum about that tomorrow afternoon as well. So again, we can pick those up in a bit more detail on the call. So thank you for being on the call. I think there are thousands of people on the call, and so I'm now going to pass over to Mary to talk about the survey that we've just done today.
Thank you, Kevin. Thanks for passing over to me, and good evening, everyone, and thank you for joining us on this call. There are thousands of you listening to this, and we know that these are really critical times, and we're delighted to be speaking to you. Now, the NEU put out guidance last week, very clear guidance, which went beyond what the government had said and beyond what other unions had said in respect of doing as much as we could to keep all our members safe when they are working in schools. So we said, and we've just put out a survey of that, and in 2 hours we've had over 9,000 responses, and we think that advice has been really effective. So the vast majority of schools are open today, operating on a restricted basis in terms of pupils. Our survey tells us that over 85% of schools are operating a rota. That was NEU advice, that staff should be rotated so they have time to stay at home, time to work from home, and time to take time off. And we're delighted that 85% of schools are operating that rota. What the survey tells us is that nearly 90% of vulnerable staff, those are staff in the high-risk categories, they're being allowed to work from home. However, only 64% of staff who have people in their home, relatives, people they live with, only 64% of those are being allowed to stay at home. And we say that any teacher or leader or support staff member who has a vulnerable family member or someone they live with in their home, then they should not be in school, because the dangers of them taking the virus back to their home and severely impacting upon the health of their loved ones is really clear. So we want an improvement in that. Just over half of the teachers in school today, we're not actually looking after a group of students. So we want to know, if they weren't actually looking after students, what were they doing in school? We think that teachers should only be in school if they're involved in actually looking after children, and that should decrease the amount of time that teachers are spending in school. The majority, over 70% of the respondents, were looking after groups of between 1 and 10 children. So that's good. The numbers appear to be smaller, and that is what we're looking for. But we are concerned that less than half the schools that the people we survey, our members, less than half the schools they work in have a distance protocol, and only just over a third had a protocol for moving around the school. We strongly believe that we should try and achieve, and as far as possible, social distancing in school. So those are the results of our surveys today. We do think we are having an effect. We don't think that staff would have been rotated on this basis unless we put out that guidance, and we certainly don't think that vulnerable staff would have not been in school had we not put out that guidance. but we're going to keep pressing those messages to Gavin Williamson.
Thank you, Mary. So if you've just joined us and if you've got a question, what you need to do is press 0 on your keypad and you'll get put through to one of our operators. But I think now we've probably got our first question coming through. Hello, is anybody there? Well, whilst they get put through,
Hello?
I'll just let you know. Oh, hi there. Go for it.
Hello? Hello?
Hi.
Hello?
We can hear you.
Hello,
Sorry about that.
Hello, sorry. Hello. You've probably answered a little bit of it already, except I just really want to know kind of where I stand. My daughter and husband both have asthma, and I've since Friday been emailing my head teacher 3 times to request working from home after looking at some of the advice that you've been giving. This has now been refused, and I have been put on the rota to work in school in the next 2 weeks. I know it is a rota that's, so we're not in school as much as we would be. When I then questioned my head as to why this was, why I'd been put on the rota and refused to have my request accepted, he told me it was because he wanted to keep it fair. And I just wondered where I stand as far as saying, actually, I'm not going to be coming into school next week. Or this week.
Thank you. I think, Mary, can you answer that one?
Oh, well, yes, I can, Chris, and thanks for the question. I'm sorry, what's your name? Emma. Hi, Emma. So I have a daughter with asthma as well, and I know what a chronic and serious condition it is. And with COVID-19 affects your lungs. So the NEU advice is clear. Asthma is a serious illness. Asthma UK have clear advice on their website about whether asthma is serious enough to stay at home. Does your husband and daughter, do they need flu jabs? And there's also advice about it depends on what's in your inhaler. So if they do those things, it's not a question of fairness. This is not a question of fairness. This is a question of your health. And the fact that if your husband or your daughter gets the COVID-19, they are going to be really severely impacted, really potentially gravely impacted by the effect, because they are immunocompromised with their lungs anyhow. So you should not be going into school, and that is our clear advice. And if there's any problem with that, then we'll provide support. Okay, thank you very much. Thank you ever so much.
Can I add something to that?
Yeah.
So, I mean, just to absolutely agree with what Mary said, we are being told that people with asthma, that there's serious asthma where people are being told they have to stay in for 12 weeks. But even the milder asthma, they're saying you can go out, but they're saying you should try and avoid going to the shops. So they're clearly worried about those people having contact. And we think on that basis that you would be bringing contact home to them. So we worry for your husband and your daughter, and we also worry if your husband or daughter got seriously unwell. I mean, hopefully if they got it, they wouldn't get seriously unwell. But if they did, they would then also have to be in the hospital, maybe in the ICU, and that makes it more difficult for everyone else as well. So on both those reasons, we think you shouldn't be in school. Now, we issued a letter yesterday that people are using, that school groups are using to send to their head teacher, where people agree these points. And so if your staff would agree to send that letter, then that might persuade your head teacher. But like Mary said, we'd want to support you in that. We think it's really important that we keep the NHS away from as many cases as possible and keep our members and their families as safe as possible.
Yeah. Thank you ever so much. Thank you.
Thank you. I'm afraid we're not able to take any more questions because we've got a huge queue. But just so you know, we've on our website, neu.org.uk, we've got loads and loads of detailed advice and guidance. And obviously it's a very fast-moving situation, but that's being updated all of the time. So that should be your first port of call if you don't manage to get a question in tonight. At a time like this particularly, we need the NEU to be as strong as possible in every workplace. As Kevin said, we do have thousands of fantastic workplace reps, but if where you are you don't have an NEU rep, please do think about putting yourself forward. Look at the Get Involved part of the NEU website. And if you do put yourself forward, we'll support you all the way through. But we'll take another question for now, please.
Hello.
Hi.
Hello. Hi. My question is actually quite similar to the last question. However, my husband is diabetic, so he's not the higher risk group, but he is increased risk, so he's been told to work from home for 12 weeks. And I just wondered where I stand on that, because if he was to get ill, they've said diabetics can get quite poorly, so should I be in work?
Kevin, would you like to go first with that one?
I think we'd answer that the same way as we just answered the question from Emma. I guess there's a question mark, not a question mark. If in your school there aren't then enough staff to run it, then there might be a question that you have to think about. But if there are enough staff who, because generally we're finding there aren't that many children in, we're pleased. I mean, that's it's not uniform, but in most cases the numbers are quite small that are being reported, and we think there are enough staff who aren't vulnerable or living with vulnerable people that they can do the work on a rota basis, so they're not in a huge amount, and we think that most people would be very willing to do that. So, and if that's the case in your school, then really we don't see any question mark about this. We think your head, in order to protect your husband and in order to protect the NHS from the consequences if your husband was to get poorly, that your head should ask you to work from home.
Yeah, there's only 11 children at the moment in the school, so.
Yeah, and how many staff who aren't vulnerable?
Like 10 plus, I'd say.
Yeah, so there's enough staff to run that group, isn't there?
Yeah, definitely.
So you might need support from the other staff to approach them and say, look, you've had this union advice, you think it's better for society and for your husband. Are they all right with it? And will they support the idea that you go to the head, that they go to the head with you and say, we really think that
I think my worry is
you should be at home.
My worry is that I've spoken to my head already about it and got quite a negative response about it, similar to the last lady. So I know there's a discussion there, but it's almost going to be a bit of a war. So if she turns around to me and says, you have to be in, it's kind of like I'm choosing between
I think the thing to do with that is to try and respond to the changing advice. Now, I haven't just listened to the Prime Minister, but somebody's just texted me saying it looks like lockdown is imminent. Now, I don't know if that's true, but the advice keeps being ramped up. And on the basis of the advice being ramped up, there's an opportunity to go back to the head and say, look, in the light of the new advice, they are really telling people like my husband that he shouldn't be out. I really think for him and for society that I shouldn't be there. So instead of going back and saying you're having the old argument, just make it about the new advice.
Thank you.
Okay, thank you.
Yeah, thank you very much.
Thanks. We can take more questions, but just to say there might be a bit of a wait because there's such a long queue. So if you do have a question, as I say, just press 0 on your keypad and you'll get through to one of our operators. But for now, we'll have the next question, please.
Oh, hi, it's Debbie in Bexley. A couple of questions, please. Some trusts have asked their staff are working from home to complete admin tasks like ringing round children to check on their welfare weekly. So what's the NEU position on that? Easter holidays, we've got some heads saying you can take this week off as your first week of your Easter holidays. But my understanding, unless the government changed the law, we don't work in the holidays, and should we choose to, we need to be paid to do so. And people are off sick, if they've been off sick and they're on half or zero pay, and now schools are closed, they can't go into school, what's the position on pay for them?
Thank you, Debbie. Mary, are you okay to go first on that one, please?
Yes, I'll take two, and I'm going to, someone's going to be giving us advice about the 0 or half pay, Andrew. So The ringing round children, checking on their welfare, I really do not see what the point of this is. Of course, if you have children who are particularly vulnerable, if they've been identified as particularly vulnerable, they're not on, that they don't have any HCP, but they are vulnerable, then there may be a case for ringing some children and some young people and just checking on their welfare. I can see that's a reasonable thing to do. But as a routine activity, ringing around every child you teach or every child in your form, I just don't think is an effective use of your time. I don't really know what it is that schools are wanting to achieve from that. So with all these things, we think it has to be proportionate. We think it's reasonable if you think, well, that is a really vulnerable child and wouldn't necessarily be picked up, then that's probably something we'd want to do. But it should definitely not be a routine thing to do. And the question for the Easter,
agree with that.
Yeah. Sorry,
yes, I was agreeing with you there completely.
Yeah. I mean, really, what you ring round, and it's a sort of you won't get through to loads of people. You ring round, and then and what are you supposed to do? But there are some children who you would want to, wouldn't you? Do that. For the Easter holidays, all these things should be done in negotiation. Now, the government has said they wanted schools to stay over Easter. So what we say there is if the schools are open, there will be some staff in Easter, but they should have their Easter holiday then, either before or after. I mean, Easter's not going to be a wonderful event this year because nobody's going to be going anywhere, and it might be quite hard to get Easter eggs, but you should have your same amount of holiday either before the week you're in or after the week you're in. And that's why these rotaring, the rotas are so important. It really is important that there are rotas, because it shouldn't just be that people are in work at school or in work at home. With the numbers of children in school, it's also essential that people have holidays, because they need rest and recuperation at this really, really serious time. And either Kevin can or somebody will get back to you about zero pay or half pay.
Okay, thank you.
I'll pick that up. Go on, Debbie.
Sorry, Kevin. My only issue about the holidays is that obviously this is a very special case, and we all understand that, but futuristically, we don't want the government to start saying, oh, well, you work that Easter holiday, we can take a week off here or lose your holiday.
That's why we think it's important for it to be negotiated and voluntary. I mean, term dates do vary at Easter, and many schools go up to Easter Friday, and many schools often start on Easter Monday. So we think it will be okay for people to have a fortnight off before Easter, but a clear fortnight when they're doing no work, or a fortnight off after Easter. We think that can be run. I'm a little worried about us pressing for extra pay over the Easter holiday. I'm not sure that will look right, whereas I think we can make sure that everybody gets the Easter holiday. On the half or zero pay, that's not a question that's come up for me before, but so this is an off-the-cuff answer, and maybe we'll do some more work on it. If somebody is still ill, then they would stay on half pay. But if they now think they are fit, if they could get a sick note, then I would say that they should return to full pay and they should be working from home and joining the rota. If they can't get the sick note just because the NHS is so blocked up and they can't get to their GP, I think we should try and insist that they are fit and they should be treated as fit from when they say they're fit. But they would then have to join the rota or be working from home. We'll look at that in some more detail and get back to you.
Thank you, Debbie. Can we have the next caller, please?
Oh, hi, Kevin. Sorry. My name's Rob. I'm calling from one of the reps in the Oasis chain. And I suppose my question mostly is about kind of what do we do next? And to give you a bit of a sense of where we're up to, I mean, last week we managed to get Oasis to agree to most of, if not all our policies, but more importantly, to agree to support the idea that they'd send a letter to all their heads asking to have joint meetings with our reps and kind of agree the way forward, which meant this weekend, working with the reps, we managed to leverage quite a big change in not all of our schools, but most of them, towards accepting the idea of voluntary rotas, towards doing proper kind of health and safety within schools. And going forwards, they've agreed to like a weekly emergency, like national JNCC. So this week we've put on the agenda the idea of what we do around homeworking, getting some guidance, and getting some kind of guidance that gets sent to schools about the risk management of people who are in schools working at the moment, and the idea of Skype calls to reps to feed it in. One of the things I'm quite conscious of is that now most of our reps and most of our members are home working. I was wondering what ideas we had for how do we sustain kind of organisation and pressure on heads to work with us and do the right thing over the next couple of weeks.
Who's taking that, Chris?
Do you want to go first on that one, Kevin?
Okay, yeah, I'm happy to. Rob, thank you very much for that call. I happen to know that Rob is lead rep at the Oasis Academy chain and is doing fantastic work there. And the agreement that Rob talked about, it's an agreement between the NEU and Oasis about how to behave during this crisis. We're about to, I think tomorrow, we're going to send that to the chief executive of every academy trust and to the sort of lead rep or the lead member of staff who's dealing with it. So that's fantastic. I think, Rob, you asked what's next, and you mentioned two things, and I think those are things that we'll probably want to talk about more on this call. But what the home working is like, that's going to be an important thing. We're seeing some heads, the silly ones, demanding lots of reports and deadlines, and we're seeing lots of places where that isn't the flavour of it. And the question we think of the health and safety in the school now, of cleaning, of hand sanitizers, and we're going to get some guidance out tomorrow on that, which we think would be a really good thing to discuss in the JNC. In terms of keeping contact, we'll be giving advice on that. We think reps being in WhatsApp groups, we're looking at other technical suggestions to make. In the union, we're using Life-Size as a way of having video calls, which is very effective and people can use, but I know other people use Zoom, and we'll get some advice out about that, I think.
Thank you, Kevin, and thank you, Rob. Can we have the next caller, please? Hello there. Hi, have you got a question? Sorry if there's a few silences. We're all in different places, so it's a bit tricky sometimes to coordinate. But is there anybody there with a question?
Yes, hello.
Hi there.
Hello.
Hi, would you like to ask your question? Yes, we can. Thank you.
Okay, because I can't hear myself in the earphones, so I wasn't sure.
It's all right.
Yes, so my question is about expectations working from home. We have been sent an email from the head who is expecting us to set assessments, mark it, have feedback and have grades over the internet. I don't know how useful that would be. This is secondary school, local authority school. And the second point I wanted to ask is about appraisals. We were due midterm reviews. They almost went ahead if it wasn't for strong union resistance that we put up. And what is the stance of that coming back in the autumn? How meaningful these appraisals would be? What's the union opinion on that?
Thank you. Mary, can you take that one, please?
Yes, I can. I'm happy to take that one. Sorry, what's your name?
It's Agnieszka, sorry.
Right, hi. So,
hi.
This is obviously a head teacher who just does not understand what is going on at the moment. It is simply not appropriate to expect staff working from home to be setting assessments, doing feedback and giving grades. And the reason why it's not appropriate is it just will not work. This is not education as it has been in the, up until now. We're not in the same system. We have children working from home, and they are, they will have different places to work. They will have different access to the internet. Some of them who will have parents who could help them. Others will have parents who are not able to help them. and it is just not feasible that you can really expect children to be doing major assignments and getting grades. It's just not an understanding of the situation we're in at the moment. Now we are.
Is it possible for NEU to have like clear advice that I could copy paste? Because I know NSUWT has.
Yes. So we are going to be putting clear advice on the website tomorrow about what it is, what the sorts of learning, the sorts of activities which is acceptable for teachers to do at home in terms of learning. And what we think is that, you know, young people will not be working 5 or 6 hours a day. We are not going to be giving them lessons. Most schools are preparing learning packs. We think that will involve at most 2 to 3 hours activities a day, probably in bite-sized chunks. And we should not be setting anything which requires routine access to the internet or access to IT devices that lots of children won't have. So basically, we're now in a situation where you do what you can, but what you can has to be reasonable in the circumstances we're in. And certainly, setting lessons online as though you would still be teaching them and giving grades as though you would still be teaching them, that is just not doable. The other part of your question was about mini appraisals, and again, this is a completely different situation. I get the sense from what you said in your questions that you're in a school where there's an awful lot of data crunching, an awful lot of emphasis on progression, and an awful lot of ranking students and grades. Now listen, we don't know yet what Ofqual is going to be saying about how the grading for this GCSEs and AS and A-levels will happen. What we do know is it will be a mixture of teacher assessment, it will be a mixture of looking back to the grades that schools have achieved before, and teachers rank ordering pupils and moderating assessment. We don't think it's useful to do anything other than just trying to get children to have some ideas about learning until we've got a much better idea about what Ofqual will be saying. So,
is NEU actually working with Ofqual? Because I got some information on Facebook that certain BTEC courses, they're asking for the work to be sent, but people are self-isolating home. How's that going to be?
So we are working with Ofqual. We're working closely with Ofqual. We have a policy advisor working with them, and we're talking to Ofqual and the exam boards as they develop their guidance on assessment for exams, and that includes BTEC and vocational assessment. But we certainly don't think at the moment that teachers should be rushing into schools and collecting BTEC assessments, that you should not be in school unless you have to be in school to look after children.
Thank you.
Thank you for calling. As we line up the next caller, just to say if you do have a question, press 0 on your keypad. We've got quite a long queue, so if we don't get to you tonight, do check out our website, neu.org.uk, because we've got lots and lots of detailed advice and guidance on there. It's been updated all of the time. But we'll take the next caller, please.
Hello, hi.
Hi.
Can you hear me? Hi,
yes.
Good. I'm a cover supervisor, so it's quite tricky for me to work from home, and I have multiple sclerosis and arthritis, so I'm on an immunomodulated drug and an immunosuppressant. I don't yet know if I will be receiving one of the 1.5 million letters, but in any event, I'm definitely in a vulnerable category. Will I still be getting paid if I follow the advice and self-isolate for 12 weeks?
Okay, Kevin?
So there's a question of government advice and there's a question of negotiated advice as well. And let's be clear, we're pushing a bit further than the government advice. Somebody with multiple sclerosis, you're in a very vulnerable category, and we think that any reasonable employer would be paying you to be at home. And you're right, it might be more difficult for you to have work from home. We would think that you should collaborate if the head can identify something that you can do from home. But I think in these special circumstances, we would want to see the head paying you. Now, I think that you might have to do that through through talking with other staff and saying, I'm just not fit enough to be in. I want your support. I want to be at home. But if your head, in those circumstances, says that he's not going to pay you, we would want to know about that, and we would want to say something to him about it or her about it, and for us to get in touch with them and say that's really not on. And I think a lot of heads would be very embarrassed if they thought that we might be raising that with them. I think you do have to put your health first. So we would want to support you in that, and I think the other staff in your school would want to support you on it as well.
Yeah, that's brilliant, because I've been there for 14 years as well, so I know that generally I get 6 months full pay and 6 months half pay, but I just don't know where I stand with this, so that really helps, and it's good to have your support. Thank you.
Okay.
Thank you.
Great. Thank you for calling. Can we have the next caller, please?
Hello.
Hi there.
Hi. I've got 2 questions. I recently went back to work after being off sick for some time, and my pay would go down to half pay. I've completed my phased return, and I'm living with my mum at the moment because when I was off I was suffering with stress and anxiety. She's actually 71. My head even mentioned it today that perhaps I shouldn't be in school because she's obviously in a vulnerable group. What would my pay be halved if I was to work from home?
Okay, Mary?
Well, as you've completed your phased return and you're back to work, your pay should not be halved if you're staying at home, because you're following government advice. And the head is clearly aware of that and is...
She is.
And
she's
has
very
said,
supportive.
Right. So, you know, I would talk to your head and say, look, I've completed my phased return. I am worried. What is it that I can do at home to support the school and to work and to help? So show willing that you want to support the school and work on a rotated basis, rotated at home, so that you do have time off and you do have your holidays. But what is it you can do working at home to support the school? And I think it should. From what you're saying to me, I don't think it will be difficult for you to have that conversation with your head.
No, I don't think so. We've already been given a list of jobs to do at home anyway, and I've already started on them, and she's aware of that. So, yeah.
Well, she should be delighted then.
Yeah. The other question is just about lockdown. Should the country go into lockdown, how will that affect schools? Do they still stay open for those few remaining children, or because we've only got 2 at the moment in school, and we're on a rotated system, and actually a lot of the staff got sent home because a lot of the children that said were coming in didn't come in. But I'm just wondering about like complete lockdown. How does that even work?
Well, it depends how the complete lockdown is done in this country. Different countries are doing it differently, and we'll know more about that when and if we do have complete lockdown. I mean, it's important to say that the NEU is supporting schools remaining open for the children of key workers who can't look after them elsewhere, because we want the National Health Service to keep running. We want food stores to remain open. We want the basics of life have to go on, and we want to play our part in that. But we want to do so safely and as well as we can. If it gets the complete lockdown, we don't know. That's something we would then have to find out from government what that meant.
Okay. Thank you very much.
We're just hearing that the Prime Minister's making an address to the nation at 8:30 p.m. today. So we'll look at what he says and get a reaction out based on that as quickly as we can. Might be tomorrow rather than tonight, but we will respond to what he says in that address to the nation.
Okay, thank you.
It's obviously a really fast-moving situation, and there's a lot of demand. There's over 2,000 people on the call right now, so we'll put on another one of these calls just to keep people updated as we move things forward.
Don't know.
So we'll take the next question now, please. Hello?
Hello?
Hi, I think we can hear you. Hello? Hi, would you like to ask your question?
Hi, yes. It's concerning pay really and my responsibilities. I'm a part-time teacher. I do Monday, Wednesday, Thursday, Friday. At the moment, normally my daughter goes to her grandparents on a Wednesday, Thursday, Friday, but now classed as vulnerable, so she can't go to them. On a Monday, she normally goes to nursery, which is still available. My partner's also a key worker, and he works 5 in the morning till 1 in the afternoon. I've said to the school I'm willing to, do the afternoon, obviously still do a full day Monday. I even offered to do Tuesday afternoon. But their only response to me via email was, oh, you probably won't get paid as that's not your contracted hours. So I'm feeling very stressed, to be honest, about the whole situation. I just wanted to know where I stood, really.
Thank you. Mary or Kevin, who wants to go first on that one?
I'll go. I'll give it a go. Thank you very much for that question. I mean, you could see that at normal times, the head might have a point if you're not available on the days that your contract is to work.
Yeah.
But I don't know what the situation is in your school. In most schools, there is a rota of staff. And so if you can say that you would work on Tuesday afternoon, then you could be part of the rota on Tuesday afternoon and another teacher wouldn't have to be on the rota that day. So there's no reason why you shouldn't be paid. You could be doing the amount of work that you're currently doing in the ways that you're describing it. So I'd hope that the first response that you got back that you probably might not be paid, that when they think about that wouldn't be the final position they come to. It's clearly possible to allow you to work at the times that suit, the situation you're in as a key worker yourself and with a husband who's a key worker. So I would hope that your head would listen to that and that the other staff in the school would support you in putting that to them, and we'd certainly want to support you if it came to an issue over it.
Yeah, I got an email today as well. Well, the whole school got an email with a rota. So I looked at the rota, and it was clear that not all members of staff were meant to be, were required to be in every day. So I replied back saying, I can see from the rota that not everyone is in every day. Can I, is it still possible for me to do afternoons, whole Mondays, whenever I can? I'm trying to help. And their reply, it wasn't very helpful. So I'm just, I'm just a bit confused by it all, really. So.
Okay. Look, I think you should email our advice line, and so that we can receive that as an individual question and look for individual support for you in taking that forward. But I think your school is being foolish in that situation. You can see the rota. You can see it would be easy for them to make a simple amendment which would allow you to work on other days. Unless the school's got a convincing reason about why that doesn't work, then it's not a good reason for them not to make the change that would allow you to be paid. But do contact our advice line.
Thank you. Thank you very much.
Okay.
Thank you. We've got about 15 minutes left, so we'll take the next caller, please. Hello.
Oh, hello. This is Sarah.
Hi, Sarah.
Would you like me? Hi. Would you like me to ask my question?
Yes, please. Go for it. Thank you.
Yeah. I've been in school today. We did have very minimal children, less than, we had 12 altogether, but within sort of from our preschool up to year 6. But we have been asked by our head teacher in any times when we're not actually supervising children and we are in school to do general cleaning, take down displays, sort cupboards. And I had, there were TAs in my school who were in there to do that. There was a lunchtime supervisor in there just doing cleaning. Is that something that we are required to do? Because my understanding is that we are supposed to be going in school for the benefit of the children of key workers, not necessarily doing jobs that are to tidy up the school.
Thank you, Sarah. Mary, can you take that one, please?
Yes, I can take that on. Sarah, you absolutely should not be going in to do those jobs, and for two key reasons. First of all, schools are meant to be opening on an emergency basis to look after the children of key workers. And so the only jobs that people should be doing in school, if you're a teacher, is doing that childcare. It isn't essentially childcare. If the head is requiring staff to be in to do other jobs like you shouldn't be doing deep cleaning. You shouldn't be taking down displays. You shouldn't be doing anything like that, because that means there are more people in that school, more adults, with more possibility of transmitting the virus to each other and to catching the virus from the children. It should be the minimum number of children in the school and the minimum number of staff who are there to care for them safely. So you need to tell your head teacher that what they are doing is dangerous. They are putting you at risk. They are putting the other members of staff who are required to be in school at risk. They're not safeguarding your health and well-being, and frankly, they're not treating you as professionals. Frankly, it's an outrageous thing that your head is requiring, and it should be stopped immediately. And you can tell her that Mary Bowstead from the NEU has said that. And if she doesn't, well, then we'd like to hear from you with your head's name and school, and we will publicise that about what appalling practice it is.
Because the lunchtime supervisor that was in when I got in at 8 o'clock was cleaning the staff room, and her and one of her teaching assistant that was in have told me in confidence that they've been told by the head teacher they will not get paid if they didn't turn up to do that. They're contracted hours.
Well,
so,
this is, I was told when I walked in, you're on the rota, but you're down for non-contact time. So I said, well, am I going home then? And she said, oh, no, we need you to do some jobs in school. I said, well, my understanding is I'm here to look after children. She said, oh, well, I'll put you with the children then, which I have been doing today. Right, do you have a rep in your school?
No, we don't. My local rep is Stephen Baker, because I'm in Worcestershire. Yeah. He's just a Worcestershire-based rep.
Well, Stephen Baker would be a very good person to contact, but if you we've got a new category of reps called COVID-19 reps, and if you were willing to sort of volunteer to do that, we could support you in really making that case to your head teacher. She sounds, frankly, to be fairly awful. She should not be treating her staff like that. She should not be coercing them through the threatening of loss of pay. And she's endangering their health and the health of the children. It's quite a terrible situation. I'm sure Stephen would be quite happy to, I know Stephen Baker very well, be happy to support you with that. Yeah. But if anybody on this call feels that they can step up and your school doesn't have a rep, and if they feel they can step up to becoming a COVID-19 rep, and just representing their staff with the support and the force of the union behind you, that would be great, because we can very quickly stop this nonsense if we stand together. If you stand together collectively, join the union, and just say, no, this is wrong for all these reasons, then we can stop it, and you can stop this in your school tomorrow.
Yeah, I'm due to work from home tomorrow, which I mean, I've been told, I can do things like marking, assessment, updating the learning platform, updating policies as a subject coordinator, which I totally agree with, but I just find it ridiculous that we're being asked to do things like that are summer holiday type jobs that we would normally do.
And you're being asked to do them at a time when we're being, our guidance, the NEU guidance is that it should be the minimum number of children in school, the minimum number of teachers and support staff to look after them, and no one else should be in the school. We're saying parents should not come into the school, visitors should not come into the school. Does your head not realise what a critically dangerous illness this can be? And she should stop behaving like that. It is unethical. It is unprofessional. Yeah. It is immoral.
Yeah. Yeah, I mean, we've got workmen actually outside on the playground who were putting up a mobile classroom, still doing that, which they're not obviously inside the school building, but yeah, they're
really,
even
this
there
is
as well.
against the government's advice, isn't it? The government is saying that we
Well,
should
to
all
me
be
it is,
working
yeah.
from home, if at all possible. So
Yeah.
you don't need to be in cleaning cupboards or taking it down or putting up displays. You should be at home rather than
Right.
doing that. So people should only be in. Teachers and TAs should be only in if they are working with those children.
Yeah, that was my
Thank you for calling,
understanding.
Sarah.
I mean, I did say that. Okay, thank you.
Sorry, we're going to have to move on to the next one, I'm afraid. Just before we finish at 7, if that's okay. Can we have the next caller, please?
Hi,
Hi.
well, I'm on a rota and I'm going to be teaching Friday, and I was just wondering what social distancing looks like when you're working with children, because I do know that some of the children have education, health and care plans, and they are running up to you, hugging and such like, and one of the children, you need to change their nappy. And so I was just wondering what protocol should there be? Yes, I'll be washing my hands and I know that the school will be very clean, but I am worried about being so close to children.
Thank you. Mary, do you want to go first on that? Kevin, I think it's... I've lost track of
Is it my
whose turn
turn?
it is. Sorry.
Yeah.
It is your turn, Kevin. Sorry.
Yeah, no, we are issuing guidance on that, and it'll be out tomorrow. And
Great.
Partly it'll be dealing with, we're looking at the guidance around clothing and how you wash it and how you do those things in a way that minimises contact with the virus or potential contact with the virus. So I don't think we can go through that in great detail on this call now, but you're right that it's a really crucial question. And, you know, as well as, like you say, the hand washing, but the question of what clothes you wear, how they get washed, we want to deal with that in specific detail. We want to get Public Health England, if we possibly can, to sign off on guidance. We're hoping to do that jointly with NHT and ASCL. It might be coming out during, you know, some of it tomorrow and more of it during the week, but it's a vital issue for all of us.
Great. I really want to help, but I do want to know how I stand.
Sorry,
Thank you very much for getting in touch. Okay.
Brilliant.
Thank you.
Okay. Thanks.
Just as we line up the next caller, I'm afraid we can't take any more questions because we've got a really long queue, but we will repeat this exercise, so look out for an invite, and hopefully we can do this again. But we'll take the next caller, please.
Hello? Hello, this is Jane from Wales. Can you hear me?
Hi there.
Hello? Oh, hi.
Hi, we can hear you.
I'm John.
Thank you.
Okay, sorry. My question is about disabled children, teachers who have disabled children, and if they're single parents or if their partners are key workers, are they able to request to work from home? Can they expect to have reasonable adjustments put in the situation? I'm thinking of the Equality Act, because the children who have disabilities such as autism, they are going to find it really difficult going to a different school if their school is not open. And in my area, we have hubs, so lots of schools are closed. So in that situation, is it okay, and do you think it's acceptable for teachers to request to work from home?
Thank you for your question. Mary?
Yes. So, yes, we do think it is absolutely reasonable for you to request to say you need to work from home. Is it your child has autism?
My child does, but also I'm a school rep. There are quite a few members. We are a huge school, and there are quite a few members in the same situation.
Yeah. And really, we know, well, I'm certainly no expert with children on the autistic spectrum, but what we do know is that going out of routine is very challenging for many of those children. They need to know where they are, and certainly going to a different school with different children in it and different adults would be just a hugely challenging for many. Just they wouldn't be able to do it. So yes, we do think that that is, absolutely reasonable. If you have a child who is on the autistic spectrum or a child who is disabled, then of course it is acceptable and reasonable that you can ask to work. You say you must work from home. Absolutely.
Okay, and if that's refused, if the head decides that that's not reasonable?
Well, again, do you have a rep in your school?
Yes, it's me.
It's you. Well, then you're in a great
Yes.
position of power. You're in a great position of power. You can say, well, my union says it is reasonable, and if you, and what is the head then going to do about it? They can say they're going to discipline you. Well, we will support you. They can say, well, we won't pay you, and we will again oppose that. This is one of the great things about being in a union. When the going gets tough and you collectivise and you have the power of the union with you, and you are the union in school as the rep, you're a powerful person. And just say you were talking to the Joint General Secretaries of the National Education Union last night, and that, it is a perfectly reasonable thing to do if you have an autistic child or a disabled child to say that you should work from home.
Oh, that's great. Thank you so much. I know quite a few members will be relieved. Thanks so much.
Thank you.
Thank you for joining us. Can we take another question, please? Just to reiterate, our website has so much detailed advice and guidance, so do have a look on there. It's getting updated all of the time. Sorry, I cut across to you. If you could ask your question, please.
Yeah, hi. It's kind of always been asked already, but if we go on complete lockdown, will that include vulnerable children as well staying away from school? And also then how is our pay affected? Say, for example, I'm in the vulnerable group because I have bronchitis, so I shouldn't be in school. However, will my pay be affected? I'm also changing schools at Easter as well. I'm staying in the same county, so that isn't an issue, but I'm in the situation where I will be starting a school but not starting a school, which is a bit strange. But yeah, I just wanted to know how my pay could be affected. Thank you.
Thank you. Could you take this one, Kevin?
Yeah. So the question of lockdown, as Mary said earlier, it does vary slightly from country to country, and we'll be listening with interest to what he says at 8:30. But you'd expect that obviously NHS workers will still be going to work. There'll be some public transport workers who are required to get NHS workers to work. Food distribution still has to happen. So we don't quite know where we'll be on that. But you'd expect that some more children wouldn't be at school than now, but we just have to wait and see. But the question of pay, if you're on a permanent or a fixed-term contract, we don't expect there to be any issues around your pay. So if because there's a lockdown, your school closes, we don't expect any issues for pay for you. Now, there is the category we were talking about before, agency supply teachers, TAs on agency, that will depend on contracts, but we are pressing the case very strongly with the Chancellor and with the DFE to put that problem right. But if you're not in one of those categories, there really shouldn't be an issue with your pay.
Okay, yeah, no, I'm a permanent member of staff, so that's right. It's just the fact that I'm leaving one school and then starting a new school at Easter. So but again, yeah, I'm going from permanent.
There are arrangements in place around that that are in the Burgundy book, and they cover when people move from one school to the other, and the new school that is receiving you will just have to start paying you. Now, they may be confused about that for some stage, for some time, but it will be clear, it will be clarified, and on something like that, HR departments also understand it, and they will also, if the receiving school doesn't quite get it, all the HR professionals will be given the same advice as us on that. They will have to start paying you.
Okay. All right. Can I just also say thank you to both of you for everything that you're doing as well in this really stressful time. So thank you.
Thank you. We're just really proud of our reps and our members, and you are heroes doing the right thing for our country. and the uni wants to do everything it can to support all of you in that time. So thank you.
Thank you.
Thank you. As well as the website, do look out if you don't follow us on Twitter and Facebook, because we're putting out lots of material through there as well. I think Mary's just going to make some closing remarks before we finish off.
So Kevin and I want to thank all of you for being on this call and for engaging in how to deal with this unprecedented situation that we're facing in the most responsible, professional way and a collective way, looking out for each other, looking out for your colleagues and your friends, and acting as the best unions act, which is to work together to improve things for all, and that's what you're doing. If you want to become a rep, can you go onto our website? It's neu.org.uk, and there's a link to becoming a rep. And all we're asking you to do is complete a form, and then you can take up your responsibilities during this time of crisis. And then when the crisis is over, and we hope the crisis will be over as soon as it can be, but it may be a few months when it is over, then you will receive training and support to really to represent your members in your school, to improve the working conditions and improve the education of the children and young people in this country. Because in the end, that's what the union is for. It's to make schools and colleges better places to work. And we know that if we look after the people who work in schools and colleges, then they will look after the children and young people, and education standards will improve. As Kevin said, we think you are heroes. We're delighted that you joined us on this call, and we are so proud to serve you. So thank you.
Thanks very much, everybody.
We'll end the call now. Thank you.